A very good day to all of you. Today we are going to do the last lesson from grade 10 Health and Physical Education lesson series. And the lesson that we are on is about overcoming challenges confronted in life. In this part of the lesson, we are going to focus on first aid. So first aid is a lesson that should be done practically, but here we are going to try and cover the theoretical parts of this lesson. Importance of giving first aid. So there's a possibility of saving the life of the patient because we are not trying to let the patient get worse. So it's going to save the life of the patient. And also number 2, preventing deterioration of the condition of the patient. So like I mentioned before, we don't let the patient become any worse. So it's going to help him to survive. And also sometimes the patient can be cured completely through first aid. Like if the patient is not in a serious condition, first aid might help to get him recovered completely. Then there are some qualities that a first aider should possess, like proper knowledge, training and skills in giving first aid, does not get easily ruffled, means does not get easily disturbed or distracted, patience, has the skill of acting as the leader or member of a group, has presence of mind, that means being really careful and mindful about what he's doing, assertiveness, vigilance, working with perseverance, that means you consistently keep on doing what you are doing despite the difficulties, is empathetic, that means you feel the other person, does not feel loathing. Loathing means like a feeling of dislike or disgust. It should not be there when it comes to a first aider. Does not feel ashamed because the first aider might have to act promptly. It could be anywhere at any time. Clarity of speech. He should be real clear about what he is speaking. Is concerned about self-protection. The first aider should be protective of himself as well, and also treats everybody alike. So having a first aid kit is really important, especially when it comes to a classroom, a sports room, workplace, or even at home. So a first aid kit can either be a box or a bag which is labeled so that it can be identified easily from a distance, and also it should be really easy to open. It should be easily accessed. And then a first aid kit usually contains a sterile gauze, ordinary gauze, bandage, crepe bandage, plaster, soap, disinfectants, gloves, a pair of scissors, a candle and a box of matches, a pen, sheets of paper, a few packets of Jivani, paracetamol, tablets. So if you are wondering why there is a candle and a box of matches, it could be due to many reasons. One is it would be a really valuable addition when it comes to emergencies involving power cuts. With the darknesses, you might need the box of matches and the candle, or else it could also be in a way of providing the patient warmth by any kind of means. This could also the candle and the box of matches could be a great start. So next we are going to talk about basic life support. So basic life support in first aid is a set of life-saving techniques, and this is followed by healthcare professionals and trained first aiders to address breathing and cardiac emergencies in adults, children, or even infants. So there's A, B, C, D, E in a way kind of a mnemonic. Let's look at what they are. So A stands for airway, and here the first aider should first check whether the patient's airway has been affected, whether there are any blocks. If something is stuck or even if the tongue is blocking the airway, they should find a way to remove that obstacle and to facilitate the breathing. And the patient's posture can also be changed to help breathing. And also if the neck seems to be injured, they should make sure that the patient is put on with a hard collar around the neck, because that can help prevent any other possible injuries to the spinal cord. And then B stands for breathing. The first aider should check whether the patient's involuntary breathing, that means whether the patient just breathes normally, and if not, action should be taken to give artificial respiration, like CPR. And then C stands for circulation. By feeling the patient's pulse at the wrist area, either or the foot, the first aider should check whether the patient's blood circulation is taking place properly. Then D stands for deformity. That means the first aider should next check whether the patient's limbs can be moved or not, because otherwise it can hurt or cause injuries to nerves and bones. So if any such damage is noticed, the first aider should make sure that the affected area is supported with splints so that the damaged parts are kept immobilized. The damaged parts should not be moved. A piece of cardboard or strips of wood can be used for this purpose. And if there has been any damage to the spinal cord, use either a spinal board or a long wooden plank to support the back. Then comes E, the last one, which stands for exposure or environment. So the whole body of the patient should be checked, and this may require full exposure of the patient's body. The entire body of the patient should be well checked, and also if the environmental conditions are unfavorable for the patient should be taken to a safe place. In case of any injury to the spinal cord, the patient should be moved in the manner that a log is rolled. I hope you know how a log is rolled. So that is how the patient should be moved if there's any injury to the spinal cord. And also another safer method is for 4 people to lift the patient in one command. So you absolutely can't do this without proper training. So you have to make sure as a first aider to be properly trained. Alright, so let's assume now you are in a situation where there is a victim. The first thing you have to do is you have to make sure the victim, any bystanders at the scene, and you are safe. And then if everybody seems to be safe, like you are not in a danger anymore, you can check the victim for a response. So if he responds, you can leave him in the position in which you find him, provided there's no further danger. Like I said, if you think that environment is not going to cause any more danger, you can leave him as he is, and then you have to try to find out what is wrong with him and get help if needed. If he responds, you can ask what's wrong with him. He might say that he's injured in his leg, or he might hurt somewhere else. So you have to keep on asking him and try to get a response. If he does not respond, that means you have to shout for help. Shout for help in the sense you are asking for advanced medical attention from doctors and nurses, or maybe until an ambulance arrives and pays him the attention that he needs. And make the victim, so what you have to do next is you have to make the victim lie flat on his back, and then open the airway using head tilt and chin lift. Suppose the victim looks a bit unconscious, so what you can do is you have to place your hand on his forehead and gently tilt his head back. That is how you do the head tilt. And then with your fingertips under the point of the victim's chin, you lift the chin to open the airway. right? We can see that in the next figure. So this is how you do the head tilt and the chin lift. So now you have opened the airway. Then what you have to do is you have to look, listen and feel for normal breathing. For that you can look for chest movement, listen close to the victim's mouth for breath sounds, and also feel for air on your cheek. You can do whatever of these things and see whether the victim is properly breathing or not. And suppose you figure out he's breathing normally. Now the person is sort of unconscious, but he's breathing normally. After that, if he's breathing normally, you can turn him into the recovery position. As you can see, step 1, 2, 3. So there's a way how you have to bend the arms and keep it under the head. And also there's a way how the leg is bent. Now the victim is on his side. You can see how the arms and legs are placed. So you have to put him into the recovery position and get help from the ambulance service. And you have to keep on assessing that he breathes normally. And suppose he's not breathing normally. So you do all the chin lift, the head tilt, and you figure out he's not breathing normally. Then you have to start chest compressions. For that, you place the heel of one hand at the center of the chest. You place the other hand on top of it. You interlock the fingers and you start compressing the chest. So you have to give about 100 compressions within a minute, and you can push down to about 5 to 6 centimeters. Equal compression and relaxation should be given. And when possible, change the CPR operator every 2 minutes. Like every 2 minutes, if the person who is giving CPR could be changed, it's better. And while giving chest compressions, you have to combine that with rescue breaths as well. So that should be a rescue breath should be given after 30 compressions. For that, you pinch the nose, take a normal breath, place lips over mouth, and blow until the chest rises. This takes about 1 second, and then you allow the chest to fall. So you have to continue with chest compressions and rescue breaths in a ratio of 30:2. That means 2 rescue breaths should be given within 30 chest compressions. And in the meantime, you have to stop to recheck the victim, but only if he starts to show signs of regaining consciousness. That means maybe he tries to cough, maybe he opens his eyes, tries to speak or move purposefully. And if you feel like he is starting to breathe normally, you can then only you can actually stop to recheck the victim. And if he's doing okay, maybe you can give up on the resuscitation. Otherwise, you should not stop the resuscitation. You should keep on going until you get some help from the ambulance or the doctors and nurses. So giving first aid depends on patient's condition, like how serious the patient's condition is. And here we are going to talk about such important situations. So the first one is when a person has fainted. What you can do is you can lay the person flat on his or her back, ideally on the floor or else on some suitable place. And then you have to elevate the person's legs to restore the blood flow to the brain. So you keep the legs up, keep them somewhere up so that it helps the blood flow to the brain. And he might gain his consciousness faster. And then loosen the clothes, also provide adequate ventilation in order to breathe properly. Check whether the patient has any injury. In the meantime, you also have to see whether the patient has got any injury after fainting. When a person has high fever, so if the patient is wearing warm clothes, you can remove them and put on some light clothing. And also it's important to take the patient to a place with good ventilation, with good air circulation. Sponge the armpit, groin areas with lukewarm water. So you are trying to bring down the body temperature. Cold water or hot water should not be used for sponging, but you should not go to extremes of cold water or hot water. Lukewarm water is ideal. The patient should drink plenty of fluids to stay hydrated. In the meantime, make sure that the patient drinks a lot of fluids. And then the next one, when a person is bleeding, you can put a piece of clean cloth on the wound, apply pressure on it, or you can bandage up the area in order to stop bleeding, because bleeding is the problem here. And then the injured part should be kept in an elevated position, like we talked about it here when a patient has fainted. Here also you have to make sure that the legs are, well, especially the injured parts, are kept in an elevated position, especially when it comes to legs, higher than the level of the heart. Keep the injured parts immobilized, do not move them, and then you have to take the patient to hospital for medical treatment. The person gets a fit. The greatest danger that a person who has gone into a fit is faced is of losing life due to falling. Like they might fall, drown, or maybe due to blocking of their airway. So when treating a patient with a fit, he or she should be made to lie on the left side of his body, which is the recovery position. We talked about the recovery position in the first few slides. That is where the person is lie on the left side of his body, and so that the airway does not get blocked with phlegm and vomit. So the recovery position is the ideal way to keep the patient's airway clear. Also, do not insert anything into the patient's mouth, and keep any object that could cause danger away from the patient. What's important is that you keep the patient's airway clear. Number 5, when a person suffers a concussion, so follow the ABCDE method, the basic life support method, and take the patient immediately for medical treatment while keeping him or her in a posture that is not risky. And if the patient is unconscious, the person should not be given anything to eat or drink. The next one is when a person fractures a bone. If a fracture has occurred, or if you suspect that there's an internal fracture, you have to support that part to keep it immobilized. Do not move it. To reduce the pain, you can use slings, a sling, or a collar for that. And then when it comes to a situation where a person dislocates a joint, so a person without proper training should never try to correct a dislocated joint. A dislocation occurring for the first time should never be corrected except by a trained professional. So keep the affected area immobilized. That means do not try to move that area using splints or a sling. Now this is a sling. You can either use a sling or a splint to keep it immobilized, and you have to get immediate medical treatments as soon as possible, because dislocations are really painful. And then next situation, when a person chokes on some object. A person may choke on small objects like parts of a toy when it comes to children, or even pieces of food. It could happen to adult as well. So this can obstruct the patient's breathing, and that can even cause death. Immediate action should be taken to remove the object that is blocking the airway. So the method of doing this, it varies depending on the age of the patient. So in case of a small child, what you have to do is, like in the picture shown here, you have to make the child face downward by keeping the upper part of the stomach on the bent knees, and give a few blows on the back with the hand. So this is how you do it. And then if it's an adult, you have to stand behind the person, put your arms around the waist and tip the person slightly forward, and you have to press hard into the abdomen with a quick upward thrust as you are trying to lift the person up. Then you have to repeat the thrust until the block is dislodged. This method is called Heimlich maneuver. And then if a person has got an object stuck in the nose, what you can do is you can tickle the nose like with a coconut fiber and make the patient sneeze, because sneezing is the natural way which clears your airway, especially in your nose. So the object is most likely to come out, but if you fail to get it out, do not try to take it out using any equipment. Take the patient immediately to a hospital. And then snake bites or animal bites. So this may be painful, can cause infections and even death. So one thing you have to do is you have to take measures to alleviate patient's fear. And then keep the affected area immobilized. That means do not let the patient walk. Wash the area with soap and flowing water. Give paracetamol tablets to ease pain. And then refrain from giving any food items like fruit juice, king coconut, young coconut water, which contains high potassium. Because the venom of a snake could also produce a lot of blood potassium, so you should not make it even more higher, because then that's going to affect the blood sodium concentration and blood pressure and all. Then what you have to do is you have to take the patient immediately to a hospital. What should not be done when giving first aid for animal or snake bites is do not use your mouth to suck out the venom, and applying any tourniquets is also not recommended. Another situation is losing consciousness due to electrocution. So a person might get electrocuted if struck by lightning, or touching an exposed electric cable, or making contact with damaged electric wires in houses, or by some other means. So it could result in losing consciousness. So before giving first aid, you have to check if the person has contact with the electricity supply, like if he is still in contact with the electricity supply. Then you have to disconnect the electricity supply by removing the plug, or by you can turn off the main switch. And then if the electricity supply cannot be disconnected, you have to remove the affected person using a dry object. You have to make sure that you are either wearing rubber slippers, rubber shoes. That means you are not going to conduct any electricity through your body as well. And you have to use a dry object like a dry stick, a dry broom shank. That means something which will not conduct electricity, something which is not metal. And then you have to make sure to alleviate the fear of the patient, calm him down. And if there are any burn injuries, you can treat them using the first aid methods. The hands and the legs of the first aider should not be wet. Yeah, like I mentioned before, you have to make sure that you are not going to conduct electricity through your body. Then when it comes to burn injuries, as a result of severe burn injuries and rapid loss of body fluids, infection and shock can occur. So this may even lead to death. Immediately what you can do is take the victim away from the danger, and then you have to try to cool down the burnt areas and keep the burnt areas in water. Hold the area under flowing water, or pour water onto the burnt area. You can do this for about 10 minutes or until the pain stops. And then remove any tight clothing or other objects like a wristwatch before the burnt areas start to swell. You have to make sure that the patient is not wearing any tight clothes or other tight objects. Then you can probably the clothes will also be burned and stick to the body. So carefully cup the clothes that have been soaked in boiling liquids or chemicals. And then you can cover the burnt areas with clean cloth, lay the patient on a stretcher, and take the patient immediately to a hospital. There are also certain things which should not be done when attending to burn injuries. So do not remove any material that has been stuck on the burned areas, like even if you try to remove the clothes stuck to the patient's body, if they are like really stuck on the burnt areas, do not try to remove them because you might take off skin parts as well. So do not apply oil or fats on the burnt parts. Do not use any sticky substances like plasters to hold the dressing because the skin is already damaged a lot. You don't want them to come off again and again. And then do not put cotton wool on the wounds because they might also get stuck on the wounds. If blisters have been formed, do not try to break them. Then if it comes to an instance of poisoning, certain poisons enter the body very fast, while some of the poisons, they just enter very slowly. So in the case of some poisons like acids or bases which could cause burns entering the body, what you can do is you can give some sips of hot water and then take the patient immediately to the hospital. But if it's something like a highly volatile substance like acids, detergents, kerosene or petrol, do not make the patient vomit. So because it can cause the mouth, the larynx and the stomach to burn. If you bring it back, it's going to burn everything on the way back. So when some poison that does not cause any burn like poisonous seeds, roots, mushrooms, maybe something that the person has eaten, such things can be vomited. You can make the patient vomit in such cases, because after the patient has vomited, then you can give more liquids to drink, and then still you have to take the patient to the hospital. But when it comes to like highly volatile things like acids, detergents, kerosene and these kind of things, you should take him to the hospital and not let the patient vomit. Here also you do the same, give some sips of hot water, remember, and then take to the hospital. So when poisoning is suspected, remove any clothing which has come into contact with the poison. If any poison has come into contact with the body, wash the affected parts well with soap, because sometimes certain types of poisons can get into the body through skin as well. Make the patient feel comfortable and make him calm down. If the patient is unconscious or confused, you can turn the patient so that he or she lies on the recovery position, and do not give anything to drink, and take the patient immediately to hospital. So if possible, take the poisonous substance to the hospital for the doctor to see. Transporting a patient. So transporting a patient who suffers injury should be done really carefully, because lifting the patient or carrying the patient to some other place should be done in a way that the patient does not feel pain, or the condition of the patient should not be getting any worse. So when lifting or carrying a person who has had an accident, there is a possibility of the spinal cord getting damaged, because you never know what's going on inside the person. The patient might also not even know. So you have to make sure that you transport the patient very carefully. So to prevent that, when the patient is being taken to a hospital, make sure that the patient lies on a flat surface, even like in a plank of wood, so that the back and the neck of the patient is not bent. So next we are going to talk about some of the ways which can be adopted in transporting patients. So these methods can be used when carrying a person who suffers injury to a safer place. Like if the patient has been found somewhere near a fire, or maybe taken out of a pool of water. So this is how you have to do it. Let's look at that in the next slide. So this is how you can do if you are carrying the patient alone. And the other thing to remember is we are assuming now the patient is not injured the patient does not have any injuries to his vertebral column or his neck. So what you can do is you have to bend down and hold the patient by the shoulders with both your hands, and then you raise him or her up with a single gentle lift, and then you put him in a sitting position. And then when the patient is in this posture, you can support him with your knees, and then put your arm under his armpit and hold him by the upper arms with both your hands, and then you can lift him and bring him to a safe place. Let's look at how to support a patient who is able to walk or limp. So you stand by the side of the patient's wound. So you are on the patient's wound side, right? Put the patient's arm over your shoulders and hold the patient's wrist with your hand. Put your other arm across the patient's back under his free arm. Hold the patient's upper arm and support him to walk. So if you go through the previous slide and the picture of the last step, this might be more clear for you. Then how to carry a patient who is conscious with the support of another. Now here you are assuming that you have the help of another. Hold each other's arms as shown in the picture. The picture is in the next slide. Let's have a look at it. And form a chair for the patient to sit. The chair is formed with 3 hands and the free hand is used as a support to the patient's back. So here you see you have formed a chair using 3 hands and using the other hand to support the back of the patient, and then make the patient sit on your arms, holding onto your shoulders with both hands. How to carry an injured person seated on a chair. So this method can be used to lift or carry an injured person who is in a critical condition. For example, if you are supposed to carry up or down a narrow corridor, or maybe even up or down a staircase. So if the first aider is unable to support the injured person single-handedly, you can tie the person's chest area onto the back of the chair with a towel or a blanket. Tie the person's legs with another onto the front legs of the chair as well. Let's see how a blanket could be used as a stretcher. So there should be at least 4 to 6 supporters in order to use a blanket as a stretcher. So you just lay the patient on the blanket and then roll the edges of the blanket. After that, you kneel down face to face with the person in the opposite side, and you hold the rolled edge of the blanket firmly, tightly. And then every person should stand up, lifting the patient at a single command at the same time. And then you put the hands under and across the patient's body. The patient's neck should be supported with one hand. Here you can see that. Gently and slowly lift the patient onto your knees at a single command. Now turn the patient towards your body. Now all 3 persons should stand up at the same time, lifting the patient. Carry the patient to the relevant place and put the patient down in the same manner. So now this is assuming that you don't have a blanket as a stretch or anything. These are like 3 people trying to carry the patient, and this is how you do it. So that brings us to the end of the lesson. Thank you so much for listening. And we have completely covered the grade 10 lesson series in health and physical education, and there are some more lessons coming up for the 11th series as well. So see you next time. Stay tuned.